CKD stands for chronic kidney disease. In case you are suffering with CKD or have recently been diagnosed with it, or if you're just curious to know about it, this presentation is for you. But in any case, you may be perplexed and find it difficult to accept the diagnosis as you do not have any symptoms and may feel perfectly normal. This is because chronic kidney disease is symptomless until the disease is quite advanced. Before going any further, we shall briefly review the functions of the kidney. And one of the main functions is to clean the blood of the waste products. Kidneys keep our bones strong. They do this by participating in the vitamin D metabolism. They also help in the production of red blood cells. This is by stimulating the bone marrow with the help of a hormone called erythropoietin. Erythropoietin is produced by the kidney. They also help in regulating the blood pressure by producing a hormone called renin and also excreting the excess fluid and electrolytes in the body. So it's also a common knowledge for us that we know that patients with kidney disease most commonly have a very high blood pressure. Apart from this, they also help in excreting the acids that are accumulating in the body because of the metabolic processes that happen in our day-to-day life. So they eliminate the acid and maintain the optimal pH in our body. What we should know is our kidneys are made up of small subunits called nephrons. About 10 million are present in each kidney. So we have about 20 million nephrons in both the kidneys combined. Whenever we suffer from chronic kidney disease, these nephrons are damaged and they are not functioning well. When the nephrons are damaged, they don't function well. In a normal person, the urine that is produced by the kidney contains excess fluid and the waste products. In the patients with CKD, the nephrons are damaged and hence the elimination of waste products is suboptimal. Apart from that, there is always a leakage of protein and sometimes the red blood cells in the urine. Whereas in a normal person, the urine contains excess fluid and the waste products, but it is devoid of protein or red blood cells. Whereas in a person with CKD, we frequently find protein that is leaking in the urine and sometimes even the red blood cells, and the elimination of waste products is suboptimal in them. So let's now look into the causes of CKD. Diabetes is the major cause and the largest contributor for CKD. This is followed by uncontrolled high blood pressure. Patients with high blood pressure, which is suboptimally treated, are the ones who can develop CKD in the years to come. Patients who consume certain medications, most commonly painkillers, very frequently are also prone to develop CKD. Also, certain drugs, especially drugs which are used for the treatment of cancers, can also damage the kidneys. For whatever reasons, if the kidneys are shrunken in size, they are the ones who progress to develop CKD. And as we grow old, there is always an attrition in the nephron number. And so if we have any insult which can affect the kidney, these elderly patients are prone to develop CKD. Also, if you have a family member suffering from CKD, you may be prone to develop CKD due to a genetic predisposition. There are several diseases like Alport syndrome, polycystic kidney disease, and some of the variants of focal segmental glomerulosclerosis which run in families. So if there is a family member who is suffering from CKD, it is always prudent for you to get yourself evaluated for your renal function and to see that your renal function is normal. There are other causes which can also contribute to the CKD burden. These can be in the form of renal stone disease, kidney infections, an unhealthy lifestyle, an improper diet, and most importantly, obesity in the present days. But it is important for us to note that it is diabetes followed by hypertension to be the main causes for the development of CKD. For patients who have diabetes and hypertension, it's always better they have a watch on the renal function in every opportunity that they get. When we come to the symptoms of CKD, in the initial stages of the disease, the patients do not have any symptom and may feel perfectly normal. Symptoms start appearing only when the disease gets advanced. Symptoms can be in the form of a tiredness, it can be in the form of frequent need to urinate, itchy skin, nausea, shortness of breath, erectile dysfunction in male, fluid retention leading to puffiness of the face and pedal edema, and when investigated, they may find blood or protein in urine. It is important to remember that symptoms appear late. Hence, in case if you have any risk factor to develop CKD, you need to get evaluated at the earliest. Do not wait for the symptoms to appear. Detection of CKD is simple and easy, and it involves several modalities. Blood tests are the most important. Blood tests in the form of urea, creatinine, or electrolyte estimations among the many are the ones which are frequently done. Urine analysis to look for leaking protein, white blood cells, or red blood cells is the next important investigation. An ultrasound examination is done to see if the kidneys appear normal, they are in the normal position, and if the person is born with two kidneys. More importantly, when the diagnosis is uncertain, despite blood investigations, urine investigations, and radiological investigations, a kidney biopsy is performed. Treatment of CKD starts with treating the cause that led to the CKD. Since most patients have metabolic abnormalities which can affect the heart, increase the blood pressure, and make the lipids abnormal, these need to be treated first. Medicines that protect the kidneys would be prescribed accordingly. Lifestyle changes are an integral part. A healthy diet with low salt, low protein, low potassium is vital. One needs to quit smoking and alcohol consumption. Sedentary lifestyle is detrimental. Regular exercise should become a part of life. Patients with CKD can develop a variety of complications which involve not just the kidneys but also the heart and brain. You may need hospitalization and may incur additional expenses. Your nephrologist would be the right person to discuss with you about all of this and give you a treatment plan. Getting educated about CKD is extremely important. Gather as much knowledge as you can. Discuss with your nephrologist whenever you have any doubts or questions. But it is important for you to understand that all the existing treatment options as far as CKD are concerned are only to slow down the disease progression. There will come a time in future where you would be needing renal replacement therapy in the form of dialysis or kidney transplantation. Knowing all this can be overwhelming. It can make you feel frustrated and helpless. But you don't have to go through this alone. Do take the help of your family and your doctor. your disease can always get easier to handle.